There's a problem with the NHS breast cancer screening programme. You can be a woman between the ages of 50 and 71, registered with a GP, and still not be invited to screening. You can even call your GP surgery to check if you're on the list and be told that you are, when you aren't, and you have no way of knowing otherwise. And when it all goes wrong, this is what happens.
An estimated 450,000 women aged between 68 and 71 were not invited to their final breast screening. Tragically, there are likely to be some people in this group who would have been alive today if the failure had not happened. And totally devastating to hear you may have lost or be about to lose a loved one because of administrative incompetence. Words alone are not enough. What are the broader patient safety lessons for screening IT systems? Most of all, we want to be able to promise this will not happen again.
But of course it did happen again, and again, and again, and again. For about 15 years now, the DVLA have had a system where you can put in your car registration number and it tells you when you should or should have paid your car tax. They do this just because it saves them money chasing people who haven't paid. The screening programme, though, doesn't do this for screening dates, despite the fact that it could save money and despite the entire point of the screening programme being to save lives. I spent a year knocking on every door I could find in the NHS, trying to point this out. Some people agreed with me, but no one would take responsibility or accountability. No one would take the problem off my back. And so I found myself in a very difficult and very unpleasant place.